Hey all, how have you guys been? I bet you all have a good day today. Oh yeah, let me introduce myself first. I'm Innayah Putri Warna, but people call me Yuna or Naya oftentimes, so you can do both if you want to. For today's session, I'm going to talk about one of those traumatic diseases I've ever seen in my life, which called psychotic disorder, or people usually know it with the name of schizophrenia. Schizophrenia is still included on my list of nightmares. You might be curious why I see the schizophrenia as one of my nightmares, and of course I will tell you a little experience about it. So my bestest friend, unfortunately passed away from this disorder about a year ago. And first, when I saw the symptoms which affecting her mental state, I started to feel all of this confusion. I keep on questioning things like, how did this happen to her? Is there something that she left unsaid? And my words started to fall down, and I kept on blaming myself for not being a good listener. But then I realized that it was just another fate which got sent to me and told me to keep living my own life without her. Yes, I'm as confused as you guys at first. But after I saw it with my own eyes, I just felt like this just ain't it. And to answer your confusion about this disorder, I will distinguish this into 4 elements, which are the definition, the causes, the symptoms, and finally, the preventive action. And without any further ado, let's just jump in. So talking about definition, according to Oxford Dictionary, schizophrenia is a long-term mental disorder of a type involving a breakdown in the relation between thought, emotion, and behavior, leading to a faulty perception, inappropriate action and feelings, and withdrawal from reality and personal relationships into fantasy and delusion, and a sense of mental fragmentation. Moving forward to the cause of schizophrenia, it remains unknown, and from the headline .com search, it is most likely that schizophrenia is found in some cases which came from some reasons, which one of those are genetics. And another it was most of the cases schizophrenia can come from past traumas, and structural changes in the brain can affect the disorders too. And my friend was the victim of schizophrenia, which caused by structural changes in the brain, because she never shows any symptoms of any other mental health problems before. And schizophrenia is all about brain system problems afterwards. There are 3 types of symptoms to indicate a person who got a schizophrenia problem, as reported by American Psychiatric Association. The first one is positive symptoms, which contain hallucinations, such as hearing voices or seeing things that does not exist, and of course paranoia and exaggerated or distorted perceptions, beliefs, and yet behaviors. And then the second one is negative symptoms, which are a loss or a decrease in the ability to initiate plans, speak, express emotions, or find pleasure. And finally, the third one is disorganized symptoms, contain confused and disordered thinking and speech, trouble with logical thinking, and sometimes bizarre behavior or abnormal movements. And now I'm going to show you a video of what is going on inside a schizophrenic patient, and this happened to them every single day of life.
Jangan, mimpimu belum selesai. Jangan angkat telepon itu.
Angkat aja, kenapa dibuat susah?
Hak kamu, angkatlah. Kalau itu penting, gimana? Kamu gak punya teman.
Jangan, tapi terserah deh. Cepet angkat. Ini nggak nyata. Kamu tahu kan ini nggak nyata?
Itu mungkin telepon dari orang-orang yang pernah menuduh kamu kemarin. Ingat kan?
Now we're moving to prevention measures. On this case, we surely needed treatment to control it, and there are also some tips on how to deal with it after going through a discussion with a doctor, of course. The first thing is antipsychotic drugs, and this can be used for a daily or less frequent if the person opts for injectable medications, which can last up to 3 months between injections, and of course depending on the medication. And the second one is of course counseling. This can help a person develop coping skills and pursue their life goals. And coordinated spatial care is the last thing, and this integrates medication, family involvement, and education service in a holistic approach. And then we finally came to the conclusion. If a schizophrenia patient does not receive any special treatment due to his action, it can be a serious issue and may affect to their life. And apart from that, the treatment must be done well and effectively helpful for preventing another negative impacts that possibly happen. Thank you so much for listening to me, and I will see you guys again. Bye bye.